Hello. Good morning to one and all. Yes. A very warm good morning to one and all. Respected Sri Krishnamarji, Vaidya Vinod Kumar, and our respected Professor Kunjiraman sir. A warm good morning to one and all once again, and happy Doctor's Day. As you know that this is the first venture of MVR Academy, where we started with a webinar series in different subjects. And as such, we are strong enough in the field of Agada Tantra. We thought of we start with an Agada Tantra, importance of Agada Tantra in the day-to-day practice, as well as especially the snake bite treatment is concerned. And as you all know that snake bite, it's a common public, what you call issues in developing countries. And as we are representing, MVR Ayurveda Medical College representing 60 years of excellence in treating snake bite cases, we are strong enough in treating such conditions. Started with Sri Kumaran Vaidya, later on Dr. Naik sir, and Dr. Prabhakaran sir, and next the generation like myself, Dr. Shaiju Krishnan and all, and later on, now the new generation. So I can say that the three generations of experience we have in treating such conditions, and we could like to share our experience in this particular condition, and as a budding of doctors, how the new generation can take up this condition. Why? Because we all stay away when we talk about a snake bite. If any suspected bite come to your OP or in a hospital, usually we never touch such condition. We say that better to go for an allopathic hospital, so we will get a better treatment there. Of course, some extent, the emergency management can be made better in an allopathic hospital. But at the same time, as a practicing Ayurvedic physician, the role of an Ayurvedic physician is first place in the diagnosis of the condition. Once you diagnose the case, and if you are sure enough that it is a non-venomous case, I think doesn't have to bother at all. And even though if it is a minor venomous, not that life-threatening, we can manage it very well. And some cases, of course, but when you take up the statistics, it comes around very, very less in number, which needs immediate medical attention with an ICU management. So before, even in our center, we should treat such cases and all. And the social acceptance is going to be another factor for that. We'll all discuss such condition in the presentation. And with the permission of the Krishna Kumarji and Kunjiraman sir and Vinod Kumar and all my colleagues and teachers who are watching this, let's start with that presentation, especially focused on the BMS as well as the PG aspirants of Ayurveda, students as well as the scholars of Ayurveda. What is our role in understanding or diagnosing such cases and how we start treating such conditions? Next one, please. So as you know that, okay, I don't think so there's a introduction is needed. So as you know that, among all animal species, the snakes is the one which is very widely known. Even though we believe that we know everything about the snakes, actually we know very little about it. What we know is usually a bundle of misbelief inculcated in them from childhood as a grandma's story, myth, received wisdom, or even superstition. We got a lot of superstition regarding the snakes, and as a result of that, most of the time we doesn't know much about it, but still we believe that we know everything about snake. But actually that's not the condition. We doesn't know much about the snake until and unless if you start learning in Agada Tantra in your second prof or third prof, we doesn't know much about it. So a scientific way of understanding snake is actually needed to know what are the causes for bite and how bite happening and how we can handle such conditions. So study of snakes is known as herpetologist, and a person is well versed in that's not a herpetologist. And the clinical spectrum of snake bite, which teaches about the envenomation, etc., what is known as ophitaxemia. And the worldwide, there are 2,500 to 3,000 species of snakes are there in worldwide, and among them 500 are venomous. And based on their morphological characters, they have categorized into different families. So when you look at the taxonomy, it doesn't bother much about it, but you consider then the group, they would become vertebrate. So snake have got vertebrae like human being, and they belong to the suborder Ophidia, or what is called Serpentos. And among 18 commonly known species are there in venomous are there, and of course 18 species are there. And one more important factor of snakes are they are poikilothermic, what you call cold-blooded. They cannot maintain their body temperature according to the need. So they travel from a hot climate to cold climate, and cold climate to hot climate for their what you call comfort zone. So that's the reason snake bite remain a seasonal pattern. Also, we can see in snake bites. Next one, please. Okay. So a brief idea about the snakes and what are their families you're supposed to know before knowing the thing. So major families in the Indian subcontinent, I'm concentrating on the Indian subcontinent. They are Elapidae, Viperidae, and Hydrophidae. Okay, in Elapidae, we got a common cobra, king cobra, and kite. And in Viperidae, we got rhesus viper, pit viper, and saw-scaled viper. And Hydrophidae, they are sneeze snakes are there. And India, we can see 62 poisonous species in India, very commonly seen. But among that, we categorize them into different categories that will come to later. What are we call it as big four? You just have to bother only 4 snakes because they commonly cause death in India. Other than that, all the snakes you can put in the other category once you know very well detail about it. And let's see the epidemiology of snake bite. So snake bite, as I told, remains a public health problem in many countries, especially in developing countries. And true incidence of snake envenomation could exceed 5 million per year. Sometimes it looks like what you call it is over exaggerated statistics. And sometimes some statistics, when you go to that, we see that it is not at all under graded, like it's not at all recorded properly. And we say that our experience, the 60 years of our experience in Papnisheri Vishachikitsa Kendram, we got each and every patient detail. We keep the statistics very correctly, so that that center has now become a research center for all the UG as well as the PG students from all over the world, even you can say all over the world. So for their presentation, usually they come to this particular geographical areas to know the snake bite statistics. And as I told, the 5,000 million cases, 1 lakh of them cause severe sequelae, the complications like. And in India, more and more snake bite, of course, not only in a chronological order, but still West Bengal, Tamil Nadu, where the geographical area is more favorable for the snakes, especially Kerala and all, the snake bite don't happen. And 90 to 80 to, I can tell you that 85 to 90% snake bite are non-venomous, where it doesn't have to do anything at all. We just, what you can call, consider the patient, doesn't have to say that nothing going to happen to them. So that's the reason the snake bite remain a public health issue. So age and sex incidence, when you talk about, all age group are prone to get snake bite. But a large majority, 90% of are their male aged 11 to 50 years. Why? Because these are the age group usually go outside in evening hours. And high incidence of snake bites are seen in midnight to 5 a.m. And as I told Leslie, the snakes are poikilothermic, or what we call cold-blooded animal. Their seasonal pattern is there. They are closely related to rainfall and temperature. Why? Because when the snakes cannot maintain their body temperature, cannot regulate their body temperature. When it's become hot enough, especially the first rain, etc., etc. Actually, this is also the season for snake bite. When it rains heavily, the water gushes into the small holes where snakes going to stay or reside in. So you cannot stay there. It's come out at the evening hours. So it's going to stay or lay down nearby the the small area where water bath is there. If somebody goes barefooted without noticing this, it's going to get bit the person. So that's the thing. It's a seasonal pattern is there with the snake bite. Now let's see the morphology of snake bite. A little bit about the skeleton is not very complex, very simple it is, because they do not have any appendages or what you call limbs. And all the snakes have vertebrae, ribs, and a skull. And the snakes can have between 130 to 500 vertebrae, which each pair of ribs are attached to each one. And they doesn't have movable eyelids. Very, very important. That's the reason when you look at the snakes, you feel like that snakes are staring at you. They doesn't have movable eyelids. They doesn't have limbs. They doesn't have external ear opening. And they doesn't have a sternum and doesn't have a urinary bladder. Then most of the species have only, even though they have got two lungs, but only one lung will be functioning. Other one is called vestigial one. So this is how the skeleton of a snake look like. You can see the fangs, then jaw, eyes, skulls are there, and you can see a venom duct attached to that, the tongue, etc., windpipe, and you see a lot of number of 300 to 350. Sometimes their vertebra will ranges, and each vertebrae connected with a pair of what you call ribs. They have a heart, lung, ribs. Okay. And vertebrae, they will come to that. The testes, they have the male one, and they got a rectum as well as one is another structure called cloaca. And snakes got a skin consists of a scaly integument that protect the animal from abrasion and prevent water loss. Okay, scales on the back as well as the sides are numerous in number, and body scales are less smooth, skeletal with noticeable ridges are there, because the knowing of the skin as well as the scales is very important to identify the snakes is concerned. Next one, please. Okay. Then, of course, coloration and marking. So this coloration and marking help us to distinguish one snake from another one. And this marking may be stripes, saddles, spots, diamonds, bars, bands, etc., etc. And very well such things are explained in our classics, especially Ashtanga Hridayam, the morphological features, especially the bands, how to differentiate one snake from other things. So very well observable things are there in our classics. That actually fits nowadays also to diagnose a snake by looking at its coloration and marking. Next one, please. Then snakes are going to shed their skin. When they overgrow, it's going to, or when tear and wear mechanism as such, it's going to shedding their skin. So that is called echidiasis. That's where what called snakes shed their skin is known as echidiasis. What we call in Malayalam, what we call is a padam purikan. Okay. So in a juvenile snake, going to do 10 to 15 times in a year, whereas an adult snake going to do it 2 to 4 times in a year. So when you take up the skin morphology, they got to two what we call layers of skin, and inner dermis and outer epidermis. This outer epidermis, as I told, like is subject to too much tear and wear mechanism. So periodically they're going to remove the things. And teeth and fangs. This is very, very important for us, because when you look into any of the comics or any of the sculpture of the snakes, you can see that sometimes 4 fangs, 2 on the upper lid and 2 on the lower jaw, etc., etc. Actually, we cannot see such things at all. Snakes got only 2 fangs. That's only in the upper jaw. Okay. To identify, to diagnose properly a snake bite, you're supposed to have a detailed idea of their teeth and fangs, how it is arranged in a snake. So that gives an idea about it. So for diagnosis purpose, knowing about the teething pattern in the snakes is going to be important. When you talk about a non-poisonous snakes, what you call non-venomous snakes, the upper jaw, they got 2 rows of numerous small teeth. You can see that thing, the right one. And the lower jaw, the 1 row of numerous small teeth curved towards the back side. So a non-venomous snake or poisonous snake does not have any fangs. And again, in non-poisonous snakes, there is of course a rare thing. Only in Himalayan keelback you will get a variety, what you call rear fangs. The fangs will be in the very near, very what call deep into the throat. They got the fangs. And venomous snakes, apart from these small teeth, they got 2 fangs on the upper jaw. Very clearly make it clear that it's only on the upper jaw. Usually it will be 2 enough. Of course, there are very rarely you can see, because one is broken, one is fall away, there's a chances of growing the second one, but it's very, very rare. And venom, as you know, this is a very complex structure. Okay, venom god is a poison secreted by the animal for their defensive or an offensive purpose. It is organized from their digestive enzymes. And venom gland is a modification of a parotid salivary gland. It is the structure of venom is very, very complex. It's a polypeptides. A lot of polypeptides are there, enzymes are there, toxins are there. That's the thing, species to species. when treatment aspect is concerned, we do have difficult because the very complexity structure of this particular venom. So creating an anti-venom for that do have the complication because of the complexity of their structure itself. And for the purpose of study, especially as a medical student, for us, it's very important to know that the classification we can broadly classify it into non-venomous and venomous. And non-venomous, of course, as you told, there are more than 250 species you'll get it in India as a non-venomous one. But in venomous one, we talk about as a perspective of a medical or a medical student, when a treatment aspect, we can say that there are mainly 4 snakes which causes a lot of complications by their bite. That's why they call it big 4. They are cobra, kite, rhesus viper, and sword-scaled viper. These 4 snakes are called as big 4. Cobra, as you know, we call it in Malayalam as a murkhan. Kite is Shankuvarayan or Valavalappan is local language they call. And rhesus viper is nothing but the anali. And sword-scaled viper is nothing but the churita mandali. Okay. Another 2 snakes also cause problem in our locality, what we call pit viper and sea snakes. And pit viper is, of course, is another snake which is very controversial one. People call it in different name. Actually, in our area, it's called as pit viper as a churta, but actually churta is rhesus viper. And sea snakes also have complication, but the population get affected, which is very less. And the fishermen who go deep into the sea or far into the sea, they will get from the shore, they used to get the bites. And this is a photograph shows the big 4 snakes. As you know, the cobra, the right one is the rhesus kite, rhesus viper, and sword-scaled viper. And once you know this, we could able to identify these 4. Then it's very easy to identify keep the next one, what we call non-venomous snakes. A rat snake, checkered keelback, green whip snake, and another lot of things are there. What we call sandbow, common sandbow, trinket snake, very common. This is a photograph of a what we call chera, what we call in Malayalam, what is called rat snakes. Only for it's a big snake, it's a yellow and with a reddish color, commonly yellow and black band, you'll get it in our locality. Green whip snake, what we call pachila pambu. As the name itself indicate, it is green in color. This is also non-venomous. Yes, this again. Okay, the previous one was again rat snake, and this is one what we are supposed to concentrate more on. That this is what we call pit viper. Okay, it's a pit viper, very small snake, but even though it is venomous, medically not important, but if you not handle the case properly, patient may die with renal complications. So this is the one we supposed to have in our locality. It's very common, and especially in rubber, the tapping area, where a hilly area where rubber plantation is there, and even in the what you can call nearby seashores also very commonly seen snake disease. And WHO put it under very rarely bites, but our status shows that this is the common snake which very commonly bites the things. So pit viper, of course, we keep it aside. So again, based on the systemic effect, even though recent articles say that this classification is outdated, but as a beginners, it's better to learn in this way only. Based on the systemic effect, what the snakes makes, they are called as neurotoxic, especially cobra and kite, and hemotoxic snakes are there, viper and sword-scaled viper, and myotoxic snakes are there, what we call sea snakes. So as a beginner, it's better to understand this particular way, because in snake bite, the combination also will get. So that's the thing that recent articles say that this classification is outdated. And clinical manifestation of a snake bite, it's a wide spectrum. We cannot limit. This is the, okay, when a patient comes with a particular condition, this is snake bite. Absolutely not. It is a wide spectrum of clinical manifestation we can see in a snake bite. There will be a minimal symptom to no symptoms at all will be there, and leading to systemic manifestation till the death. So it's a wide spectrum of clinical manifestation we see in snake bite. And sometimes what happens, snake bite, patient have been seen, he has bitten by a snake, but patient come to hospital without any symptom or manifestation at all. So there are 2 possibilities for that. One we call is a non-venomous bite. And even no patient sometimes brings the snake to the hospital. It is a poisonous snake, but it doesn't have any clinical manifestation at all. That phenomenon we'll call it as a dry bite. That means the snake seldom inject the much venom because they are very scary in what you can call stingy in spending the venom. So sometimes they inject a very low venom, and without releasing venom also we call it as a dry bite. without releasing venom, it's going to bite. And sometimes before biting, the venom may be spewed into the victim's body. And sometimes the bite may be on a clothing or a particular, what you're going to call the shoes or etc. It might not strong enough to pierce into the skin. So the other thing condition we call it what we call a dry bite. Next one. Okay. So once a patient comes to hospital, okay, with a suspected bite, then we have to look into the signs and symptoms of it. So signs and symptoms are the what you can call the early systemic. If the early systemic manifestation is there, then there will be vomiting and hypotension will be there. That's because of the fright, etc., etc. All other contributing factors are there, which leads to vomiting and hypotension. But as a physician, when you look into two, we can categorize it into two. One you call local manifestation, and another one is called the specific manifestation. The local manifestation is the very first sign we can see in a snake bite, whereas specific manifestation is a little bit delayed. Okay, in the system you can see the thing. So that may be because of fright. The patient may be bitten by a non-venomous snake, but because of fright, he'll have a specific manifestation. Sometimes you have neurotoxic manifestation, hemotoxic manifestation, cardiotoxic, and myotoxic. And even sometimes, even I have seen the case with a rare manifestation, like patient has brought to the hospital with an unconscious condition, but luckily he have bitten by a non-venomous snakes. So such condition will be seen. Now, as a presenting complaint, main is the local manifestation. So the local manifestation, next one. Okay. The local manifestations is an early sign of a snake bite. Within no time, immediately after the bite, it will start. And it may sometimes take 30 minutes, or sometimes even in neurotoxic snakes will take more time to that. So anyhow, this we consider as an earlier signs of local manifestation. Usually, there will be a local pain with the radiation. There will be tenderness at the bite area, a small reddish wheal, and there will be an edema. Then appearance of bulle, especially you can see in pit viper snakes, you'll get an appearance of bulle, and regional lymphadenopathy. The regional lymph nodes are going to become inflamed, and the features of necrosis. In this particular picture, you can see the features of necrosis have been started. 2 bite marks are there, little bit swollen area, and patient, of course, is complaining about a lot of pain and burning sensation. It is what we call a Russell swiper. We'll come to that later, how to identify different bites. So this is how the local manifestation commonly you're going to see if it is a venomous bite. And systemic manifestation, as I told, it is by fright. It starts with the fright itself. So as a by fright, as you know, very commonly seen systemic symptoms are transient pallor, sweating and vomiting, and cytokolical shock. But in neurotoxic manifestation, especially as I told, the cobra and crite, it will start with within 5 minutes or even take 10 hours. Because within 10 hours, this patient doesn't have any systemic manifestation at all. Even I have seen a patient with after 12 hours of bite, have shown the systemic manifestation. So that's say that any suspected bite, don't leave it as such, we need observation. National protocol on snake bite say that 24 hours observation in any suspected bite. So in neurotoxic snakes bite, we'll get a bilateral ptosis, diplopia, difficulty in opening the mouth and speaking, muscular pallor, this is coma, and finally patient will go to anoxia, isn't able to breathe and will go to die. So that's what happened. So up to 10 hours or even late, the systemic manifestation may start. So, okay, keeping this all in mind, now let's see that how we are going to diagnose a case bite or a suspected snake bite. Because you know that there is no simple, reliable, cheap, and ready-hand method for snake bite diagnosis. So the reality is, it doesn't have a simple, reliable, cheap, and ready-hand methods. So out of our experience, in 60 years of experience, Papincheri, we can say that looking into these 4 different aspects, we can diagnose a snake bite. First one, by identification of snake. Second one, by inspecting the fang marks. Third one, by laboratory lab investigation. And fourth one, most important, looking for local and systemic symptoms. Once you study this properly, the 4 identification and diagnosing points, then it's going to be easy. So identification of the snakes, as I told that more than 250 species of snakes are there in India. Is it possible to an Vaidya or a doctor to identify all these snakes? Absolutely not, because we got a lot of other to learn also, and herpetologists might do the thing. So what we do that, we concentrate only the big four snakes. Of course, here plays the importance of learning Padartha Vijnana as well as Tantra Yukti, separating knowing thing from unknowing thing, so that you are what you call Arthavati, etc., what you say in Padartha Vijnana. See, that's what we're going to apply here. So the big four we are going to diagnose, we are going to identify. The rest of the thing you can keep it aside so that you doesn't have to bother much about it. If your snake is brought to hospital, if you look into that, you could be able to identify, okay, this belongs to these four. Then 50% of the diagnosis is going to be over. So cobra, very little things I will just tell you, because in textbook you will get the details about it. It's a very common snake with a hood in that. And hood, you will get a spectacle mark, and they called naja naja. And it is, of course, an average length 3 feet to 7 feet. It's going to grow in a big snake. And it's often seen in near agricultural field and human habitation. And their favorite food is rat. So because knowing, see, when a patient comes to hospital, we ask them which place you are coming from, at what time is might happen. This all gives an idea about what might be the snake is. So, and it is an active day and night, and commonly during evening and early morning. That's the thing you might know, the recent cases of what you call Uttara assassination. A lady has been killed by her husband by throwing a snake into her body, isn't it? So such things and all, once you know the idea about it, we can know that why it is a cobra and why she's died because of any pain, etc., going to be important. Anyway, that's another topic. If time permits, we'll discuss on the thing. So that's how the cobra is. Next one is a common cry, what you call Shankavarayan, Wala Wala Pen, etc., Modira Valayan, etc., the local names, what you call. Okay. Bangarus ceruleus, very common snake, very beautiful snakes also. Okay. It's a bluish body with a brown color, and it's got a shiny body, and it's a band on the thing. It usually occurs in the fields, shrub jungle, and often found in the vicinity of human habitation. It's very, very important. And it is known to take up residence inside the house. This snake has an affinity to get into a house and bite a person. This is where I think that Mr. Suraj has got wrong thing. He bought snakes, what he call cobra. Instead of that, he would have been got cried. The thing should have been a different thing, because he would have supported that this snake has a affinity to get into the house and it might bite the person. Okay, and it has an affinity for water, and average length of this snake is 3 to 5 feet. Of course, it's grow a little bit big enough, and as it's told, it's a sky blue or bluish gray or brownish black. You know, these are different variations, but in our area we got a sky blue color with a narrow white band entire length of the body. It is a nocturnal animal, but means it's rarely it's bite in the day hours. And as I told, it enters the hut and other human habitations where people sleeping on the floor are likely to get bitten, especially in the cold season. So this is one we have to be very careful. Usually we see that person died in sleep. That is because of the crite. And Russell's viper, what we call anali, very commonly China tendon, anali, then etc. what we call. Next one. Next one. So this is a very common snake, and among the venomous bite, 90% of the bite are because of the this particular snake, what we call Russell's viper, anali. It's a very small, it doesn't grow much, it is a 3 feet length maximum grow. It's got a large brown or black oval marks on a brown or yellowish brown body. Very beautiful to look. You got a mandala akara, and that's what the Sanskrit called mandali sarpa. Okay. Its head is flat and triangular. That's one of the important diagnostic feature. Its head is flat and triangular. It got a very short and thin tail, and it usually moves at night and found in open grassy area, scrub jungle, what called rocky hillocks. That's very common, especially in Parshnikadava areas. This snake is a very common snakes. Next one. This is, of course, it doesn't bite much more, but very dangerous snake, but it is so scaled viper. Echis carinatus is not that common in Kerala, but still some of the what we call rocky areas, it is very commonly found. This is what exactly the Churutta Mandali in Malayalam. But of course, as I told earlier, for pit viper also we call it as Churutta, but that's not exactly the correct name. Even though Churutta, what you call pit viper also coils and stays there. That might be the reason people call this as a chulka. But this is snake actually the what you call so-scaled viper or Echis carinatus, very commonly seen species in and around Kannur and Kasaragod, especially Wayanad areas and all. This is what the snakes. It's very dangerous one. So it's commonly seen. It's an average 1 to 1.5 length feet. It's not a big snake. It's a very small snake it is, and its venom is more toxic. And as I told, its head is triangular, like that of a rhesus viper, broader than the neck, and it's very short, thin it has. And it's mostly moves about in the night and mostly found in open, dry, sandy, and rocky terrain. Okay, it's not found commonly with what you call water reservoir nearby water areas. And the distinctive feature is by producing a rasping sound, by rubbing it so, that's what is called as a so-scaled viper. It produces sound when it's got agitated. So by rasping, the what you call the scales is going to become sound. That's called, which is called as a so-scaled viper. So try to look into these 4 snakes, very commonly thin snake. When you come to snake park, when it opens up, you can have a look into that so that you can able to. Otherwise, photographs will be available. Keep on looking at the thing so that these 4 snakes very commonly bites, you will be able to identify the thing. So the first thing, as I told, with Aptapatti Pramana, we can say that with these 4 snakes, we are going to identify. If a person kills the snakes and get into the hospital, by looking at the thing, we can diagnose, but not 100%. Okay, because sometimes they'll get the snakes which have been not bitten down. Okay, if a person get a snake bite, all will be anxious enough. They'll what you can call running here and there. They'll look at the snake. Very first snakes, what you see, they'll kill it and get to the hospital. And 2%, there is a chances forever. What you call error for that. Anyhow, so that's how the snake when we bought. Of course, we are in a position to identify the snake. Then okay, we can confirm, or 50% we can make a confirmation. Okay, it might be a venomous or non-venomous bite. Second one, as I told that by looking at the bite marks. Okay, you try to recall. As I told that venomous snakes got only 2 fangs on the upper jaw. Okay, so with that upper jaw, there'll be a puncture-like wound will be seen in a venomous bite. Whereas non-venomous snakes does not have any fangs. They got small teeth. With the teeth, they're going to get a scratch mark. The previous slide I have seen, and this slide you can see there's a scratch mark in the thing, and with a slight oozing of blood and plasma. So of course here you can see this classical rat snakes because little bit patches things with the thing. Okay. Look into that. Again, it's a classical one. It's a blade-like mark. This is again a non-venomous snake bite. Yes, this is also non-venomous. See, look at that. There's 3 or 4 lines of scratches. Again, rat bite it is. It's not in the, in the extremities. It is little bit scratchy things with the oozing of blood little by little. This is what again it's non-venomous. And this is okay. You can make it. This is again the extremity with a scratch with the bleeding, non-venomous. But this is more important one. Look at this. There is no bleeding. There is no scratch-like thing. We can see a punctured wound there. Okay, one is very prominent. Another one is not that prominent, and already that necrosis things are started. So this is how a venomous bite looks like. Look at this also. See, they can show very 2 prominent marks with the necrosis and etc. So this is how we differentiate from a venomous bite to non-venomous bite. But don't always expect this from a patient side, because you know there are a lot of first aid measures are there, which is very wrongly we are going to do. People are saying that you have to cut the area with a blade, etc. Sometimes they bring the patient with a lot of scratch markers on such areas. So the diagnosis will be misled until and unless you are not looking at the aspect of it. So that's how the second point of us by looking into the bite mark. So we are, I think, confident enough looking into the identifying the snakes. Second one by identifying the bite marks. Third one, it doesn't got much role in the thing. What do you call by laboratory investigations? And there is an ELISA test based on antigen in the body. When you put it into the ELISA kit, you are going to get a with antibodies there. Of course, if that is not developed, it is under process. Even Rajiv Gandhi Institute of Technical in Trivandrum as well as Mysore, they have doing research on that when they could be able to identify the venom in the body so that we can identify it's a venomous or not venomous. Other than that, there is nothing else. Only for hemotoxic snakes, we have got what we call blood coagulopathy. because as I told, they are hemotoxic. Hemolysis is going to be happening because of their venom. So blood won't be clotting within the stipulated clotting time to 4 to 6 minutes. So we say it's a delayed clotting. Other than that, of in delayed clutches, you get hematuria and other presence of the thing. And if you go for an X-ray, as well as sometimes people go for ECG also. This totally only got academic interest. There will be slight changes in the ECG because of the fright and other factors. Sometimes you can see. Apart from that, there is no simple lab techniques which tells us that this is this person's body has snake venom. Absolutely, it doesn't have anything. Anyhow, we hope that soon the project will complete with identifying by ELITA test to identify the snakes. Then it's going to be easy for us to diagnose a thing. This is the most important for an Ayurvedic or any doctor is concerned by looking at the local and systemic changes what it's making the body. So as a practical purpose also, to treat the condition, this is going to be more important for us. So there, as I told, the first symptom will be a suspected snake bite will be a local symptoms. So local symptoms very commonly seen are local pain, tissue damage, swelling and burning pain. These are the very commonly seen thing. So by snake, let us analyze this. In cobra, there will be minimal local pain, there will be tissue damage will be there, and minimal swelling and minimal burning pain will be there. So if in sleep also, patient will get up by means of a cobra bite. That's what, when we talk about that, what we call Uttara assassination case, where Mr. What you can call her husband, Suraj gone wrong. Because that case, when we were discussing a nearby online media person, journalist had called me, he's the first one who made this as a sensational case. So I told that absolutely not. If it's a cobra, the patient will get up usually. But in that case, he told that she never got up. In that happened in sleep only. But it might could have been cried. Look at this. Cried, there is no local pain. The slight tissue damage will be there. No swelling, no burning pain. The patient never gets up, he's in the sleep. He just scratch the area, he turns, he go to sleep, and in the sleep, death might take place. So cried is very dangerous for the thing because it does not leave any local damage or discomfort to the patient. As a result of that, he might not turn into hospital. But Russell Swiper, there's no doubt, surely will come to hospital because there will be a local pain, there will be tissue damage, there will be swelling, there will be burning pain. So scale also, there won't be much more tissue damage, but the local pain, swelling and burning sensation will be there. So surely they'll come to hospital. Whereas in a non-venomous pain, a snake, as you know that local symptoms are nothing will be there. There won't be any pain, there won't be tissue damage, there won't be any swelling, there won't be any burning pain. But by means of fright, you'll have some other psychological feelings like that, you'll come to hospital. So by looking at the bite mark and other thing, all these four factors, we finally diagnose it's a venomous one or non-venomous one. Then clinical symptoms, but I told that you'll take a immediate start, within 30 minutes you'll start. Even in a neurotoxic snake, it will take up to 10 hours to manifest such things. So in cobra, we'll get ptosis or what you call uncontrolled drooping of upper eyelid. So that will be there. Patient could not able to manage or keep that upper eyelid in position because there is a neurotoxic. When a person loses his neurologic condition, the very first nerves is going to be weakened because this is the one which keeps us always in against the gravity, these two muscles. When it's become weaker, the person will have ptosis. Then there won't be any hemostatic abnormalities, there won't be any renal complication, but of course, emotional manifestation will be there. When you try it, there will be ptosis will be there, like that, because this is the reason we say these are neurotoxic snakes. But sometimes, very rare cases, you'll get a combination also. In a Russell Swiper, I have seen ptosis also, one of very rare 2 cases like. So there will be a ptosis will be, that's the thing, I put a question mark on that, very rare condition. That's the reason I told. Recent articles say that categorizing snakes into hemotoxic and neurotoxic is outdated. Some extent it is, okay. But as a beginners, better to learn in this way. So Russell Swiper, there will be ptosis, sometimes you will see, not always. Hemostatic abnormality will be there, renal complications also will be there, and emotional manifestation, of course. So scale, there won't be any ptosis, but the hemostasis condition will be there. Renal complication usually won't be seen there. But in non-venomous snakes, ptosis or any neurological or hemotoxic abnormalities are not seen, but there are emotional manifestation. Sometimes the patient brought to the hospital as if like he is died, but it is of neurotoxic, what called non-venomous snakes. When we able to tell the patient nothing to bother about, within 10 minutes is what you call pressure, blood pressure become normal, heart rate become normal, gradually come to the normal conditions. Okay. So after knowing this, I think now we got an idea about how to diagnose a snake bite with the 4 aspects we have detailed: identification of snake by looking into the bite mark, by laboratory investigation, and finally signs and symptoms. Once you're very precise about your diagnosis, then comes the next thing, what you call management of the cases. In this presentation, I'll be talking about in modern perspective how they'll manage the thing. In Ayurveda also we can manage the thing, but I want to give more emphasis on the first aid as well as the diagnosing part. That's what an Ayurvedic physician or an Ayurvedic doctor has a play to role. Because in the treatment aspect, you got some limitations, and there is an acceptance is needed from the society also. So if it's a non-venomous, I think we can manage very well. Venomous, I tell you what the next stage is supposed to do the thing. So first aid is the first thing we're supposed to do, then specific therapy, and if any complications, that has to be taken. In 3 way, the management will be planned. And the first aid, it itself is a big topic. We can discuss some 10 hours regarding the first aid of a snake bite is concerned. Why? Because all when you put it in Ayurvedic classics and our traditional knowledge in one side, we keep it the Western knowledge of snake bite management. It's most of the things are contradicting. So a person who is learning to both of the things should know where should we stand and what is the person containing. In national protocol, whatever the first aid what we do nowadays, salt said is not supposed to be done. Why? Because there is a reason for that. But once you do that properly, I think we'll get the benefit out of it. So an Ayurvedic physician should know in both the way where should we stand in these particular conditions of snake bite treatment is concerned, because our level of treatment has limited some extent. Only 1 or 2 centers, as if we probably say our center, and some other centers only doing the snake bite is concerned. Other people are not doing it. So you don't complicate the case with your first aid measures, what explained in the Ayurvedic classic. But most of them are mostly scientific also, if you do it in a proper way. But people do it in an improper way, unscientific way, the things like. Anyhow, the first aid, the national protocol say that do it right. Even WHO also propagates same thing. R stand for reassure the patients. The most of the procedure explained in Ayurvedic classic as the first line of treatment are explained to reassure the patients only. They say that if you get a snake bite, you catch on the snake and bite. Of course, we are not advocate that. We are not supposed to do it. Again, they said if you not get that snake itself, you take a wood log and you bite it. Nothing to, no change should be there in the venom spread in the body, etc. But it give a assurance to the patient that yes, I did a first aid myself, so I might recover well. That itself helps him to prevent the spread of venom in some extent. Okay, that's the thing. And of course, there is some lot of things has to be discussed in classics. Is it the real person who made very good contribution in identification of the snake, the signs and symptoms, etc., etc. When it's come to treatment aspect, why did he do such things which not what you call looks so what you call logically good enough nowadays? Okay, that's a different aspect. We'll discuss some other time. That is it that only work, but I only return the thing or somebody else? We have to think of that particular aspect of a classic is concerned. Anyway, it's a different topic. Okay, so first aid you have to do. R stand for what you call reassure the patient. I immobilize the patient. Then get to the hospital immediately and then tell the doctors if you see any process or the condition. That stand for right. And let's me very briefly go to some of the what you call first aid measures. What we do, like application of constricted band. Okay, Arishtabandhana mantra. Second stand for Arishtabandhana. Nowadays, what we do, most of the snake bite people does it the first aid and then get to the hospital. This should be 2 to 4 inches above the bite. And here it's important 3 by 4 to 1.5 inch wide the material you should select for tying the band. Okay, but practically it's not going to happen. People, whatever material they get in their nearby which can be tied, they will tie the things. That's what you call causes the complication in understanding what you call the first aid is concerned. Again, very tightly they tie it. It should not be tight enough because it's only the purpose of the constriction of band is to occlude the venous drainage, not to cut off the arterial blood cycle as well as what you can call lymphatic drainage. So only just superficial, it has to be not to be tight enough. but people try with whatever material they get leads to complication. And cutting and section, achushan, what explain the classics. But present day, we do also don't propagate that. Why? Because if a person cut the area, as I told, the bitten area, I told that the bite mark, it is a, what you call, it's a guideline as for to diagnose the case. If that, and usually I told that will be 2 bite marks will be that a punctured wound like thing. If a person cutting it with a nearby material, that also is a big concern. Whatever material they get nearby, old rusted blade or whatever things, in the people going to make a scratch on the things. So that will have a secondary complication like a tetanus, etc. So cutting, and we do have a doctor also have a misled by the particular things action. So we say that not to do that. Section, it says that achushana. If a person is doing sucking, if you have any ulcer in the mouth, etc., you may also get infected by the thing. That's of course in the classic we got some other ways to do the thing, but to smear it with ghee, etc. That all the precaution that they take. But still, suction, it is not advisable nowadays. Then washing the wound. Again, see, when you talk about the first aid of the thing, it is a changing trends. When you take an old edition of the book, you'll get something, and in new edition that might be not. They say it's not supposed to be done. This has to be done. You go for the next edition, the previous one is found to be effective. That's why the first aid is concerned in connection with the snake bite is concerned. It's a changing trend. Washing the wound in our institution, we say that they say with a tap flowing tap water, we can wash the wound. Then nothing ruined, nothing wrong in that. Ice pack, usually patient I told they'll be having, especially in Russell's wiper, etc. They'll be having burning pain. So to get rid of that, they'll keep the ice pack there. But ice pack, what is this called? Again, vasoconstriction that area, the venom going to be stagnant. The stagnant venom going to cause much more tissue damage to that area that might lead to a wound later on. It is going to be necrose, it's going to become a wound. So better to not go for an ice pack. And analgesic and sedation, usually we don't advise them to give, but to some extent paracetamol can be given. Of course, in the treatment aspect, not in the first aid, but analgesic and sedation never will be given. And what in Indian they say that is a pressure immobilization technique. Okay, it's advocated in India, but in practice it's very difficult to do the thing. I can show the photographs of thing. You can also imagine in a real situation in a developing country like India, especially in a village area, how people can go for such a techniques. This is military academy. They show how to do the first aid. It's a site of bite you can see. Just before that, 2 or 3 inch above that thing, you can see one more constriction with a tight one, not tight enough. And again on the top. This everything is fine here except the size of the cloth. Okay, material what they taken. It should be little more wider enough. Then only the purpose will be saved. Otherwise, it doesn't have things. So you can do the thing, but it should not be tight enough. Okay. This is what we call pressure immobilization technique. Okay, with a crepe bandage like a cloth, the entire length of the limb has to be wrapped. After that, keep a log-like thing or a straight material-like thing, and again you have to wrap the thing, then immobilize the patient, then get him into the hospital. But in Indian conditions, WHO also advocates such things. But in Indian condition, I don't think so. It's possible because when we get a snake bite, we are all panicking. We don't know what to do. People, all the people, their own idea, they're going to express on the patient. So this is one. But we do teach the people in our common classes, etc. Better to go for these pressure immobilization techniques. So first they do the thing, then the patient brought to the hospital. Once the hospital they bought, usually, of course, it's basically on the modern way of treatment, what you call a specific therapy. We start with anti-snake venom, ASV, what it called. It is a, we usually say that it's a, what you call, it's a boon to snake bite treatment, etc. Some extent is correct. But what happened, it's not that magical remedies like this. It's only neutralize. It's only neutralize the free-flowing venom in the bloodstream. Okay, if a venom is there in the bloodstream, when you inject antivenom, it neutralizes that particular venom. That venom, which already made some damage to the organs, vital organ, it has to be treated accordingly. Okay, apart from that, it's nothing. If you say that, okay, if you start with antivenom, patient is going to save. No, if it is kidney already damaged because they took more time to reach the hospital, if the kidney damage already happened, then nothing can be done in that. but it neutralizes only the free-flowing venom in the body tissue. And it's presently available polyvalent. It's a 4 snakes. Venom will be collected. Of course, the preparation of ASV is a very complex procedure. We'll take venom from the snakes, and they put it into a hose, and the hose is going to become hyperimmunized. So the antibodies from the hose are being collected. It will be what you call centrifuged and purified. Then you're going to get it. So if a cobra bite, you need an antibody of cobra to neutralize the thing. And as I told, we have a difficulty in diagnosing the case it's a venomous or non-venomous. And still more, we have, if a venomous, we cannot make it out it is a cobra or crite because both of them have similar clinical features. So if ELISA test is found to be effective, then we can make, okay, in this patient's blood, cobra venom is flowing. So we have to neutralize the cobra venom. We have to give the cobra antivenom. But presently, we doesn't have that technique. So what we do is in India, we have all the 4 snakes venom will be injected to the host. So whole 4 antibody, the host going to be hyperimmunized, and all antibody will be produced in the host body. So in an antivenom, what we call it containing antibody for all the 4 big 4 snakes. So really the question might come in your mind, if a cobra bite, unnecessarily shall we pushing into the other 3 antibodies? Absolutely yes. That's the reason it has some anaphylactic reaction. Then the giving specific therapy is not that easy also. We'll come to that later. So it's called polyvalent. But if it is in monovalent, it's going to be good enough so that the treatment going to be little more what you call little easily we can manage the thing. And it is produced in both liquid and lyophilized. Liquid antibody is also there. The powder form also there. Liquid ASC there also got some what you call disadvantage because it requires reliable cold chain and refrigeration. It should be kept in the refrigerator. And especially in India, especially developing countries, in a village condition, we cannot expect all these things. So what we do the thing, we go for a lyophilized. The powder form will be prepared. And liquid one going to expire within 2 years, whether other one, like a lyophilized got even 5 years of expiry period, and it doesn't need to refrigerate, but you have to keep it cool enough. So that's how what you call anti-snake venom. In India, there are 4 or 5 companies, they are preparing snake anti-venom. Bharat and what you call Serum Institute of India in Chennai also they're preparing the thing. Okay. This is a what you call 1 ml, 1 unit what you call, it's a 10 ml of snake venom anti-serum. Okay. Presently it's cost them around 1,965 rupees for 1 unit of it. Okay. And as you told, ASV, how to administer the ASV, anti-snake venom, how to administer. It's a very scarce and costly commodity. So 1 unit costs somewhere around 1,000 rupees. Okay, it's scarce and costly commodity. And risk of anaphylactic shock. Even this is an antibody, but it's not, it's prepared in produced inside the human body. It is from the host body. So what happens, host antibody we are taking the thing. So it has an chances of risk of anaphylactic reaction. And national protocol, even WHO say that you're supposed to give antivenom on the following condition. If the systemic manifestation like evidence of coagulopathy, evidence of neurotoxic, that is toxis, and persistent severe vomiting and abdominal pain is persisting in the patient, then only supposed to go for the what you call ASV, anti-snake venom administration. And apart from that, if you have local manifestation, as I told, the very first same symptoms like current and local swelling, more than half of the affected limb, and the swelling is rapidly extending. If that condition is observed, then immediately you have to start with the anti-venom. So there are ASV administration criteria are there, and usually we give it an infusion, okay, or liquid, as I told, liquid or reconstituted ASV is diluted in 5 to 10 ml per body gauge weight of the isotonic saline. Normal saline usually we will give in one what you call 1 unit. We will give the thing. And an intravenous injection of intravenous, very clear. It is given as not intramuscular, it's an intravenous injection infused with normal saline, 20 ml per minute, we are going to give the thing. And in older days, there are local administration of ASV is to done. Near the bite, people need to prick with antivenom, but that is found to be ineffective. And rather than it's a painful, and apart from that, we are creating still more bleeding points. If you could not able to manage with that particular dose form, we will creating unwanted bleeding points. So local administration in intramuscular or whatever intradermal, the pricking the thing is not advisable. It is given in intravenous injection, 20 ml per minute. That way we arrange the inflow of that normal saline. And there's usually a question arises, is this test dose? As I told, it will have a lot of anaphylactic reactions. So does we need a test dose for that? No, because no predictive value in detecting anaphylactoid or late serum reactions. Because the venom is there in patient's body, we have to neutralize that. For neutralizing that, we have to give this ASV. If ASV shows some anaphylactic reaction, but still you have to give it by managing the reaction for some time, then start with the antivenom. That way, we have to neutralize this. And as I told, we usually will get ASV reactions are there. So we have to give precautions of prevention, like usually we give hydrocortisone and antihistamine. Of course, it doesn't bother much about it. And usually seen the reactions are urticaria, itching, fever, shaking chills, nausea, vomiting, etc. Okay, and of course, tachycardia also seen. If in our institution, what you do there, of course, we have a combined treatment protocol there. If patient really emergency condition, really they need antivenom, then only we start with the antivenom. Once we start with the antivenom, if as I told, that anaphylactic reaction, it persists like vomiting, diarrhea, chills, and nausea, we stop the antivenom, and that has to be treated accordingly. Usually, 1.5 ml of 1:1000 adrenaline is given in intramuscularly to prevent the thing. If vomiting is there, antiemetics is given, and once the patient become, and bronchodilator also sometimes given, so that the patient become what you call out of that particular anaphylactic reaction, stable, then we start once again with the antivenom. 90% of the cases can be managed, but for some people are a bit more prone to such allergic reactions, so then we do really have the problem. Then they'll need a higher setup with the ICU and other management setups. Okay. Okay, next. Okay. So in recovery phase, what happened? Blood coagulopathy is returned to normal. The blood clotting will become normal in 6 hours. Urine turns into normal color. If it is turbid with a what you call RBC, etc., gradually it comes to normal condition. That shows that okay, kidney is coming back to normal. And if it's spontaneous bleeding, especially from the gum, it starts with that. And later on condition, if not treated, then you can get it into petechial hemorrhage-like condition from the hair follicles also bleeding starts. If it's spontaneous bleeding, especially from the gum, etc., then it can be stops. As a shocked patient, then blood pressure may be increased after 30 minutes. One starts with the antivenom and the normal saline. Then complications. This is very important, and this is the area we can manage as a physician. There are some delayed manifestations out there. Okay, if it is a very rare condition, doesn't bother much about it. It is 3 or 4 cases have been reported only, and in my practice, I've seen only 1 case. Okay, what happened? Soon after snake bite, we diagnose it as a snake bite. Patient might bought the snake bite. The snake looks to be now venomous. All the venomous bite mark, everything will be there, but there will be normal clinical and lab coagulation profile. Shortly after the bite, nothing will be there. Patient will be normal, nothing will happen. Lab things will be normal now. There won't be any systemic enough. There will be a possibility of dry bite. So we say observe the patient, we consider as a dry bite, we'll discharge the patient. What happened, even I have seen the 2 cases have been later on reported to me. After 4 or 6 days of bite, immediately patient collapse and dies. At home it will be. They'll get into the hospital, they'll have the history, nothing. So they say natural death benefit. Here, this are only 2 cases so far. When I went to take classes in nearby places, and 2 nurses have been told me such incidents. So, I of course, in the textbooks, etc., in some researchers, they told that 3 or 4, especially one in Thailand and other Sri Lanka, 2 cases are such. That phenomena, they explain in a different way. What I call that, there will be local blebs. This venom immediately don't mix with the blood, what I call body fluid. Very rare chance it is. So, as a local bleb, it's going to stay in the bloodstream as a venom depot, and after 3 or 4 days, suddenly it's burst out. Then showing all the signs and symptoms of the snake bite and patient bite. Of course, it's a rare phenomenon. Don't bother much about it.
പഴം തിന്നുന്നില്ല, അത് കാണോ? ഒരാൾ കാണോ? ഗ്രീൻ ടീ ആണ്.
Okay, there are some technical issues. Meanwhile, there are, we got now only few slides only. Once complications is over, we will show you some of the complications of snake bite, especially the ulcer, etc., and how better we manage with an Ayurvedic treatment protocol. Okay. And here we got some question of, meanwhile, the technical, I think I'm audible, isn't it? So the technical issues are there. We'll overcome the thing. Before that, we doesn't waste time. We got to one question, one Dr. Hemalata GS. I say that why should the patient be awakened after snake bite? Yes, it's very commonly seen thing. When you go to the Ayurvedic classics, they say that patient is not allowed to sleep after the snake bite. Anyway, we'll keep it the thing. We'll finish off the thing anyway. The technical things have been corrected. Now the treatment of complications. Okay, there will be a massive bleeding will be there. So of course, some extent we try with our medicine. If not possible, it can manage with only fresh whole blood has to be given. It's only in a tertiary, I call setup like an ICU setup only they do the thing. If shocks are there, the volume expanders, including plasma and blood, has to be given. If any respiratory failure, mechanical ventilation. If acute renal failure, especially hemotoxic snakes, acute renal failure is there, then it has to be handled with the hemodialysis. And there are long-term manifestations. Here, Ayurvedic treatment plays very, very important role. There are edema is there. Usually after snake bite, the wound will be there, wound healing, and the edema usually resolves within 2 to 3 weeks. Occasionally persists after 3 months, and textbook says, even national protocol, that this particular version taken from national protocol of snake bite, they say that rarely may not respond to complete treatment. Okay, so modern book says that sometimes edema may not respond completely to modern treatment. But here, Ayurveda plays a very important role to reduce that particular edema. And coagulation disturbances may persist beyond 3 weeks, especially in so-scaled wiper. Every clinically patient will be good enough. All the other blood picture will be normal, but blood won't be clotting. Now, even after 3 weeks, it will persist. But here also, Ayurvedic treatment plays very, very important. Okay, Titta Magradhaja with Thambula Sorasam, etc. If you give the thing, the blood coagulopathy can be brought into normal. Okay, and very commonly seen complications are what we call ulcers, especially in case of Russell's wiper. And as I told, people do wrong first aid because of the very tight band just above the bitten area. The venom going to be stagnating to that particular locality. It gives to an ulcer. This is a very commonly seen snake bite complications. Okay. Now you can see the different kinds of what you can call the ulcers, the complication of snake bite, different stages they are. Okay, it's already healed one. So look at this. This is actually what we treated this condition. I think the previous slide would have been give you an idea how the wound was, and gradually it's taken a long time. 3 months it took. Actually, this patient has come to Papnisheri where we given antivenom, etc. We treated him. It had a very strong, but a tight enough first aid band, which was very wrong way of doing the thing, leading to a huge ulcer. But these 3 to 4 months of continuous Ayurvedic treatment procedure, we could able to bring back that to normalcy. See, almost it's clear 4 months we could able to without losing them. This is another case. Look at the thing. On the back of the toes, he got the thing, and it was a very big snake. It was very deeply to penetrate this thing, and the wound become very complicated. But I think it took only 2 months to come back into. So you can see after being, you get here the dead tissues are there. Gradually, it's getting healed, and within 2 months of Ayurvedic treatment. This actually is not treated by I mean, the snake bite management is done by an allopathic hospital. Then they, after the bite, they asked him to go for a amputation. The body cannot be treated, but he came there, and within 3 months of treatment, he was diabetic, 60 plus, with a diabetic and other complication he had, but we could treat very well with the Ayurvedic treatment protocol of Dushtavrana Chikitsa along with the venom treatment, etc. etc. So this is all about how. Okay. So this is how, very briefly, we explained how we are going to diagnose the case and how better we can manage if we have the facilities. So to my dear friends as a doctors or as well as my students, I have an advice that don't stay away from attending any of the suspected bite. You please do attend, because presently we are thinking that Ayurvedic physician should become a family physician for that particular locality. If in your locality any suspected bite, you give an impression to people that let them come to you. You look at the condition. If you could be able to identify it is like a non-venomous, you tell the patient you doesn't have to bother much about it. It's a non-venomous. You doesn't have to bother. You give some drugs to alleviate its anxiety. Then you, okay, if needed, you can send to proper first aid, you can send to the higher centers. If you found, okay, it is a venomous bite, okay, still you have a role to play there. Do the first aid properly. And if you are confident enough to treat, okay, without antivenom, it's not that senior, I can manage, okay, you can treat the thing. And if you see that it is, of course, treated with antivenom, if you have the facilities like to overcome the complications, then you can attend the case. If not, do the first aid properly, immediately send the patient after alleviating his anxiety, etc. Say that nothing to worry, is not very simple one, refer to the nearby center and inform them that we are sending a case. That itself brings you fame and confidence and the confidence in the science. So better not stay away from any suspected bite, attend the thing. And for that, you have to read little more the thing about it, get more exposure, and our institution giving the interested doctors for the training on how to diagnose the snake bite and of course in the management aspects. So that is only my request to the humble request to all the delegates who are listening to this particular webinar. You make use of it, because these slides, everything will be available in the YouTube. You can repeatedly go through it, try to identify and try to understand what are the conditions, and and looking into that and keeping Ayurvedic basis in the mind. I think we can manage such condition, or not, we can refer the patient to the nearby center. Okay, and of course we'll come to some of the questions what you have got it. One is Dr. Hemalata GS. She asked us, why should a patient may be awake? In Ayurvedic classics, even in our traditional way, people say that if a traditional Vishavaidya, if you treat that condition, you say that patient should be awakened. Being an Ayurvedic physician, as you know, we'll know a little bit about the modern aspect also. If not in depth, we know a little bit about it. And modern say that if a patient sleeps, nothing going to happen, because as you know, once you sleep, or heartbeat comes down, respiration comes down, pulse rate comes down. So the venom does not spread much more. Of course, that's right in one aspect. Look into Ayurvedic classic. They say you should not allow the patient to sleep. Knowing both those things, learning both these two things, where should we stand? And what answer we should give to a patient? Once you give the thing, being a what you can call educated as well as qualified Vaidya, we should have a logical as well as a scientific answer for that. This can be tackled in that. See, in Ayurvedic classic, they say that patient should not be allowed to sleep. That's correct only, because our treatment approach towards a suspected bite case is purely based on subjective parameters. That means, what are the signs and symptoms we keep on ask the patient. One patient say what he feels like. Based on that, our treatment protocol is framed. Vega Anusara Chikitsa. If Vasha is in first Vega, they have explained some symptoms. Second and third. These symptoms are not objective, subjective it is, but his patient has to explain. For that purpose, and some of the things what is seen in the patient, drooping of the eyelids, etc., 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 we have to experience by looking at the patient. So that's the reason they say that we're not supposed to sleep. And to make the patient to not to sleep, there are some techniques are explained. Some anjana, of course, we do act as a therapeutic procedure. Along with that, it keeps the mind that patient will sleep. And again, if a patient sleeps, what happens? If a patient would sleep, if a snake bites patient, surely he'll get up with a nightmare, like a snake bite or he's going to die, etc., etc. So I think you might have, we all have experienced once or twice in our lifespan that we might would have been got up by a nightmare. So when you get up from your nightmare, what happens? Everything, our heartbeat increases, or respiration going to be more. So that again make the venom to spread more. So this is how we have to understand this concept of why we ask the patient to keep awake. So in my experience, we say that you ask them to, okay, they are getting sleep, let them sleep. There's nothing wrong in that. But see that the symptoms you are observing properly, and we are treating that condition in a proper way. And another Dr. Rekha asked a question: any experience in Kakapada technique and usage of medicines like Suchika Bharana Rasa? Okay. Frankly speaking, in our centers, we doesn't have that experience of making Kakapada. Okay. That shows the excellence of Ayurvedic way of life. We cannot do that thing nowadays as an experimental basis. But Kakapata, I mean, you will get in Kashyapa Samhita, etc., reference that if a medicine come in contact with the blood, a dead person will get up. And Suchika Varandasa explained the Shastra, etc., all directly we are giving the medicine to the blood. And that medicines are very, very potent enough. Okay, so such things can be, we should have a what I call a research model for that. Because in human being you cannot experiment such things. Right? We should have a correct research model. Then when we have the thing, we can think of the thing. I think future we will be having such an experiments on at least in animal basis, etc. But we don't have an experience in Kakapada techniques, etc. And experience should have very clearly explained. That's only the last resort. We say that. Okay. And another, the same doctor asked one more question: can Ayurveda doctor handle ASV? Legally, especially in Kerala, we doesn't have the legal rights to handle such a modern medicines. And in our center, we have a tie-up with MOA with very nearby what we call community health center, and we have usually the responsibility of giving anti-venom in technically goes to that doctor. Usually, give him a call. If you're free enough, he'll come and attend the thing. Otherwise, okay, doctor, you start. That's all experience. So we give the thing, but all the legal responsibilities goes to that doctor. And legally, an Ayurveda doctor is not given permission. I think in Kerala, we doesn't have that permission. But in North India also, some extent where I know my friends, they are managing all the emergency conditions, and they might have the permission, I believe. Okay, and other Dr. Hema again asked one more question: infusion duration. And of course, we actually, there are different hospitals got different in-house what I call experience or in-house protocol for giving antivenom. Okay, in our center, what we give that 1 unit of antivenom will be infused in the 1 unit of normal saline, 20 ml per minute. We start giving it. We observe for any anaphylactic reaction. If reaction is not there, we keep on adding the doses of antivenom. And fixation of doses of antivenom is empirical. It all depends upon in-house standard and experience. Textbook says something. This gives you a big idea about it. Because a cobra bite, they say that the fatal dose of cobra is 12 milligram. Okay, in an average bite, average, not mandatory that it should be 200. Average snake, if a cobra bite, average we say that it will be infusing 200 milligram. But might not always, sometimes will be less, sometimes more than that. And 1 unit of antivenom going to normalize 0.6 mg of cobra venom. So in that way, we calculate it and we'll give it. But not always, sometimes it doesn't. But we surely look into the clinical aspect. And within half an hour, as I told, if blood coagulopathy become normal, if toxis like symptoms have become normal, gradually we half an hour anyhow it will be given. Then again, if symptom persisting, we add little more quantity. As told, it's all empirical. We cannot have a correct, accurate thing. So all depends upon the clinical symptoms of the patient. And we have in our institution, we are given maximum 35 vials. Okay, you can imagine how large it will be, 35. You know, one of the seminar I have seen then, and physician from Sri Lanka is presenting a paper, and he's told that he has given 90 units of antivenom. And very old doctor, he was sitting very next to me in that particular seminar. He told that, see, gentleman, that person is lying. He said that in my experience, human body cannot tolerate 90 units of antivenom. But the presenting doctor, he was very confident with all the data he was presenting. So a lot of such, what I can call, accuracy is not there in the dose fixation is concerned. It all depends upon the in-house experience, but keeping into the guideline of protocol, we'll manage things. Okay, and one Dr. Anjana Reddy, she asked, what taste change in the snake bite? What might be the reason? Okay, so snake bite is actually called a delayed complication, especially in neurotoxic snakes, especially cobra and crite. Soon after the bite, the patient doesn't have a problem, but after the recovery phase, etc., patient usually say that they cannot taste sweet and bitter things. It's commonly seen. And for that, we have some diagnostic criteria also. Some Vishahara Lehias are explained in the classics. You give it the Tampula Patra, and patient takes it. We ask him to which taste he perceives. Based on that, we got a diagnostic protocol for that. This is because there will be, I see that because of the nerve damage to that particular perception center. That might be the reason for change in the things. Okay. So these are only the questions what we got on the things. So, okay. And one more, Dr. Shushanta Mahapatra asks, clinical experience in the help of any Ayurvedic medication. Of course, we do have an Ayurvedic medication works better in snake bites, especially as I told, 90% of the bites are non-venomous. Once you are diagnosed as non-venomous, we keep the patient, we giving Vilvati Gutika, explained in Ashtanga Hridayam, Uttaratandra, 36th chapter. It's very well explained snake bite. I think all of you should and must by heart with quotations of how Vilvati Gulika is prepared and what are the indications of the thing. Of course, not snake bite, other conditions we give. So we give him a Vilvati Gulika. We'll ask him to wait for 3 or 4 hours. If no other, what you call, psychologically or internal symptoms are not there, patient is stable, we are going to discharge in 3 minutes. If it is a venomous bite like a pit viper bite, etc., it is not that serious, we can manage with Ayurvedic treatment. We give him some Kashaya yoga, especially Lodram, Sitadi is explained, Amrudottaram Kashayam sometimes. There will give much importance to that of the, what you call, renal functions. So any Mutrala drugs usually works in Chandrapapa Gudika, Vishavilvadi, Vilvadi, etc. as a systemic things. And local manifestation, we got very good medicine like Shidru Punarnavati. Okay, Chikitsa Kriya Kaumudi also is there. Then Prayoga Samuchaya, it is explained. So such things are there. So we are going to give this that local application of that LEPAS to compact the swelling and other things. So with Ayurvedic medicines, and we usually input a water intake and output, we have to monitor for 2 days. If everything is fine enough, very well we can manage the condition, and with in our center, within the medicine costs somewhere around 200 and 250 rupees. After 3 days, patient can be discharged without much complications. So that is how an Ayurvedic medicine can be working the condition. But if it is surely, if it is a venomous bite, of course, we need as an emergency medicine. Presently, we are taking help of the medicine. Once that life-threatening stage has been overcome, then we can start with an Ayurvedic medicine that will better follow, especially result, especially to avoiding the formation of a wound and delayed complication, etc. can be managed very well with the Ayurvedic treatment. Okay, there is a doctor asked one which Alok Roy has asked. Abhay Babu, okay, Dr. Abhay Babu asked, as there are renal complications, will RFT values give the ideas of bite? Sure, because what question it is. So if renal function values, soon after a bite, it won't be that evident. Okay, after 3 hours or 6 hours later, the RF values going to be, RFT values going to be important for that. So if there are variations, we can think of that there is the chances of acute renal failure. So we have to manage with the thing. Usually within 6 hours, etc., within Ayurvedic medicines, we can manage such a conditions. Okay. And this is already, I took 1.5 hours in this particular presentation. I think whatever knowledge you got it from these particular things, You just, it will be, of course, under a slide, everything will be in your YouTube, will be kept for as much as possible. Go through the slides, try to diagnose the case properly. That's what enough an Ayurvedic physician is concerned. And as I told earlier, you should be a better in a primary or tertiary, secondary areas, you can manage it very well. And if you're not able, better you have to refer the cases. In certain cases of snake bite, death takes place suddenly within 5 minutes. What might be the reason for that? Okay, that all depends upon the condition of the patient. Okay, if it is what you can call very allergic to such a venom as a imminent or what you call immediate effect on the thing, and the volume of venom if injected is very high, and if it's a neurotoxic one, immediately death. On the other day, you have seen what called snake handler. He got a cobra bite and immediately died within 1 hour. So the quantity of venom that injected will be very high, and sometimes it will be directly to the veins. So the direct impact is going to make it on the higher centers, especially the vital organs. That means, and sometimes vasovagal inhibition will happen because of the fright also. So that also sometimes lead to cardiac arrest and patient might die due to vasovagal inhibition. So there are possibility for that also. That's how immediate death takes place because of the snake bite. First thing, quantity of the venom, then directly to the blood supply, bloodstream.
So, Dr. Vinay,
Yes, sir.
Dr. Athira Nair is asked, what is the range of efficacy of Tambula Patra in Visha Haratva? The effect of Tambula Patra. See, in our classics, okay, some of the cases in Tambula medicine has to be given along with Tambula Patra. You know the qualities of that's actually because the Vasha is a Tikshna, Ushna, Rushna, all the qualities of Vishas are opposite to that of Ojas. So immediately it's going to affect the Ojas. So we have to give such a medicine that medicine has also should have such a quality that it should affect very fastly into the body. So that's the reason the qualities of the medicines as well as the media through which we are giving it that I have explained, they should have all this Laku, Ruksha, etc. gunas to that, so that immediately it traverses to the dhatus or Agni, goes to the Agni, then to the dhatus, thereby it's going to be affecting on the Visha to prevent its effect on the other dhatus. That's the reason the drugs was you should also should have that quality. That might be the reason for that efficacy of Tambula Patra. Okay. Another, of course, name is not there. She asked, what will be the patya, apatya? Okay, it's in a hospital. When you, of course, if a venomous bite, when you treat the thing, if it's a pit viper, etc., as I told, we purely with Ayurvedic protocol, we're treating the condition. So that condition, patya is very important role. Give as much as possible rest to the vital organs, especially liver, stomach, etc. We have to give them maximum rest. So liquid diet, what explained as a classic, especially heavy, then spicy, etc. has to be avoided. In the hospital, we give Kerala food, the kanji, the very one, lagu, ushnam, anabishandi, na abhisnigdam, asankara. All the qualities we have with that of what we call in a kanji. Okay, so kanji will be given. Okay, this is a very ideal drug. Okay, all the qualities what I explained, especially of course this professional explained in during Snehapana. But anyhow, it's a ideal drug. Kanji can be given to the patient, and water intake, of course, we will monitor that properly to roll out the ARF. Renal pilus order, input and output has to be monitored. Light food has to be given to the patient. And the first day, of course, we keep it nil by mouth. Because what happens, sometimes patient takes food and something, we're going to omit it out. So we doesn't know that because of that heavy food or because of the venom, the complication like what we seen clearly. So we first day it is nearby mouth with simple, easily digestible, tiny like liquid diet we start with the thing. Second or third day you can go to normal diet, but all the spicy food, etc., has to be avoided. And the duration of Ayurvedic medication. Okay. Usually it happens, a patient is suspected bite, comes to hospital, usually if they go to an allopathic hospital, usually this blame will here. Patient says that I was very comfortable doctor, but they shifted me to ICU management. They told that we have to keep in observation for 24 hours. Only after 24 hours only, they say that we can tell something about this condition. But patient will be very comfortable in the ICU. Very next morning, usually they go in evening, very nice. Next morning, they'll fight with the hospital. They'll take discharge against medical advice. They'll come to Papnishir. Usually that will happen. So people say that they made me to get into the ICU for making money out of it. Not always, because national protocol says that any suspected bite, 24 hours observation. In hospital part, they are right enough, because as I told, neurotoxic, etc. After 10 hours, you'll get the manifestation. So they were right in their part. But common people believe that only for the purpose of making money, they made me to lie down into the or admitted into the ICU. But of course, after 24 hours only, they send the patient. But the duration usually till the normal. But in the normal condition, if it's a venomous bite, they try start treatment. Then still the clinical manifestation comes to normal. The blood profile comes to normal. We have to keep the patient in the hospital. It's a 3 to 4 days, the systemic things. The local things, if it is because of very wrong first aid, etc., etc., if there's a wound, is there necrosis started, then still the wound cleaning, etc., process we start. Dushta Vrana to a Shuddha Vrana. That till duration we keep the hospital. And after it's been Shuddha Vrana, if patient is nearby place, we ask him to come every day for treatment and all. So if a normal condition is near such complication, within 3 days in Papnisheri, we discharge the patient. And non-venomous snake bite, if there any treatment is required as per Ayurveda. Okay. If in non-venomous snake bite, actually there is no treatment is required, but we have seen there's a Sankha, Visha, etc. explained in our classics, isn't it? So because of that, patient will have some systemic manifestation, etc. If that is there, that has to be managed very well with the Ayurvedic treatment. Actually, it doesn't need any treatment at all. But anyhow, if a patient come to hospital, give them Visha Vilvadi, sometimes Visha Vilvadi Gulika, we keep the patient under observation for 3 hours, and after 3 hours we just give one more Vilvadi Gulika so that it will be applied to the local bitten area, because we doesn't want how the, because snakes, a lot of bacteria etc. will be there in their teeth. When we scratch mark, there will be a possibility of a secondary infection, tetanus, etc. So possibilities. So we just give Vilvadi Gulika rubbed in Tulasi Swarasa for that particular area, local area, and one more Vilvadi Gulika. You should be advised them for a light food for that night, and observe for urine output, etc. Usually nothing will be there. Within 3 hours, patient will be discharged. So Ayurvedic classics, nothing is explained as a thing, as a non-venomous. If it's Shankha, Visha and other thing, it has to be treated where patient get a systemic manifestation. Okay, there's a question. Sir, what is the logic behind Vishakallu? Of course, there's another thing what we call Vishakallu. People say that it's a stone which has antitoxic property. When you keep it on the bitten area, it's going to suck all the venom, and that just falls down. It shows that the venom going to be removed and the patient can be saved. Okay. So give a scientific, actually keeping in the modern terminology or modern scientific looking, we cannot give a precise explanation for that, because the Vishakallu itself is a controversial one. People prepare this in a different ways. Okay, there are some horns of some animals will be craved and they're made into small stone-like things. Some seeds have been used, and especially in Kerala, the tribal Kani people, especially in Wayanad tribals, what you call a group of people called Kani, they prepare in with pebbles. The pebbles they're going to powder. They added with Vishahara drug explained in Ayurveda. All this what you call different drugs have been used for that, and they pound it very well. They give bhavana to that. They make that stone-like material. Then they do sputum with a different drugs, etc., etc. It's a very lengthy procedure. Finally, they're going to prepare that particular charred carbonated material they're going to prepare. And this practice is very common in what you call in hilly areas, especially in the what you call hilly areas where rubber plantation methods are very common. So they are, especially in Kerala, we can say that the Christian missionaries, they are practicing very well with these particular things. And out of my experience, I tell you that it do works only to relieve the anxiety of the patient. Nothing else is going to do the thing. Okay. Even though What happened? As I told, if a patient is bitten by a snake, they go to the hospital, the anxiety will be there. Because of anxiety, etc., the patient start perspiring. The peripheral vascular supply will be low enough, so it will be wetty condition. The extremity will be wet enough. So soon as in the condition, okay, the Vaidya is going to say that, okay, nothing to worry about the thing, we can be saved well. And then he's going to keep this Vishakallu to that bite area. Because of the moist, etc., as I told, it's a very carbonated thing. A lot of samskara is gone through. Micropores will be there, and the surface where it's going to be, they're going to keep it will be wet enough. As a result, because of the changes in the osmotic pressure and iodine pressure, it's going to stay there. Okay. So Vaidya convince the patient that nothing, you doesn't have to bother. See, Vishakallu already placed with there. It's going to suck out all your vishas. So that itself gives confidence to the patient. Gradually, its blood supply will become normal. Peripheral vasodilatation will takes place. The blood supply become normal. Temperature going to be normal. When the pressure become normal, it's going to fall down, and the patient will be comfortable with it. Then he takes the Vashakallu. They put it into snake, what you call milk. So gradually, the milk's color is going to become black in color. So that again gives confidence to the patient. Say, all my venom has come out and is given the black color to the milk. But in none of the classics, when you go to the classics, not explain that Visha got black color. Okay, so this all, if it is an, I told you, 90% of the snake bite are non-venomous. Okay, it does not require any treatment other than relieving the anxiety of the patient. By all these techniques, we will see that the patients has recovered. But some centers, they say that they do it very well. I don't much about the thing. Out of my logic, I think this is how we explain about the effect of Vishakallu in such things. If it is some centers are doing it very well, we still need to know what exactly they're going to do the thing like. Okay. Okay. Are there the treatment said in Ashtanga for each Vega and explained, and do you practice that thing? No. Presently, it's very difficult to observe that such signs in each and every Vega. Vega-based diagnosis, you need much more experience, much more expertise. We are just the beginners for that aspect. When you, very frankly, we say that we're just beginners in that aspect. Of course, we can make it out, but that much potent medicines explained for that each Vega, we should be able to give. And the preparation aspect of that Vega is not that easy at all. Okay, so that is the reason we are not, even though we can observe the Vegas explain the classics by a clean observation, but adopting treatment according to that, we are not doing in our center. But yeah, of course, we are supposed to, we are started to at least assessing that particular condition. Treatment in meanwhile, anyhow, we should have a project of treating or imbibing purely Ayurvedic treatment protocol for snake bite, but sure, soon after some experimental study and all. Before that, we cannot directly, we can experience from the patients. Okay. So these are the, I think, most of the questions what they asked. And if you have any still more queries regarding this, you can just mail me. I think already they have given the mail ID. Otherwise, you can take up my WhatsApp number, so that if there are any queries more, we can discuss more on that. Because especially first aid, it's a big topic. Again, it will take 2 or 3 hours. So if time 5 minutes, we can have another session for that. What's supposed to be the correct first aid for an Ayurvedic? Not an Ayurvedic, a doctor is supposed to advocate. Things explained in Ayurvedic classics, how they become controversy when you compare it to existing modern scientific thought, especially in national protocol, etc. Because protocol, etc., are based on only the modern scientific thought, what they call upon. So everything is based on that. So what explain Ayurveda, why it's not fit for that day? So all the logical answers we have that in scientific way we can explain, but that need a long time. Anyhow, when you're doing the first day, do it in a proper way. So if you have any further more queries, I'll give you my WhatsApp number. You can take it down and you can WhatsApp me. Surely I'll respond to that. So my WhatsApp number is 9947 589 407. I repeat, 9947 589 407. You can put any queries further into that. So surely will explain. Otherwise, you can mail me even to the mail ID of MVR Academy also you can do the thing. Otherwise, or college ID also you can mail the things. Okay. The WhatsApp group also we got MVR Academy, that also you can. Okay. So I think already we have 10:30. All of you will have logged into the things. We have taken 3 hours off. So thank you all the viewers for joining with us, and take use of these 2 hours, 3 hours what you spend in understanding this concept, and let it through by an Ayurvedic physicians. Let this knowledge going to be useful for the public people. So with all gratitude and respect to our beloved Kumar and Vaidya and all other eminent doctors who are working in Papincheri Vishigilsa Kendram, and all our college, especially our directors, Kunjiraman sir, all our vice president and medical superintendent, vice principal, medical superintendent, and all my colleagues. I think that what the expertise we have shared with you. To please make use of it so that the community will get benefit out of it. That's way the propagation of Ayurveda in the field of Agata Tantra going to be beneficial. So thank you all for your listening and responding to the question. Thank you.
Okay. Thank you, Principal. He has done a very good job explaining all the things related to the snake bite treatment and management. As you know, Papancheri Vishigilsa Kendram is now the PG Research Center for Agata Tantra. Agatam now has been converted to the clinical subject. So I request all the viewers, participants from inside and outside Kerala, you can come over there to Papancheri Vishigilsa Kendram for have an in-house study, stay and study about the protocol that we were following for the last so many years. You can have project work. Even scholars and scientists and doctors who are visiting our center for the last so many years. You are most welcome. We are trying to convert that into a center of excellence. Already a project has been submitted to the Ayush Ministry, and we are expecting a positive result on that. We want support of request the support of Kumarji and Vinod Kumar Ji also for that center of excellence. And as you know that we were applying Ayurveda and allopathy treatment protocol for the snake bite and other skin diseases also in that center. Actually, we have that data statistics regarding the treatment of pit viper, exclusively management under the Ayurveda protocol. And as you know, as a part of that, we have the snake park, MVR snake park, where we have all this collection of snakes, venomous and non-venomous, for the last so many years. You can also visit that center to have a study on that regarding the lifestyle and effects of the snakes and reptiles. And we are also planning two things we are planning. One, we are planning to conduct an SBT, snake bed treatment course, apart exclusively texting from the experiences that we have all these years, a short-term course for all the incumbents, maybe from any fraternity, even including allopathy. And second one, we are also planning for a Herpetol Institute under our snake park for conducting very micro-level scientific studies for the management of the snake bite patients, a Herpetol Institute. Apart from adjacent to that, we are also planning to conduct degree and PG courses regarding environmental studies, forestry, herpetology, UG and PG courses, and also research. So we have a humble beginning. The MVR Academy is now conducting all these webinar. We have a good beginning actually. I once more thank Somaji and Vinod Kumarji also, and all the participants outside and inside in Kerala and also all parts of the world. Next month, we are continuing this program. Dr. Vineet George will be giving you the schedule for that. Any queries you can ask through the WhatsApp or the mail. He is most welcome. And when we get this COVID stabilized, we can visit our center and college also for discussing with our faculties and also researchers, research workers, etc. So thank you for that. August also we are planning an international Ayurveda webinar exclusively for resource persons from outside India, from all parts of the world. We are planning that also. I request you also to join all these sessions. Over to Dr. Vineet George. Thank you.
So that was an extensive session, and we had 3 hours of session coming out, and we had almost 353 participants coming up with it. We'll be issuing a participation certificate for each and every participant, and the e-certificate will be registered, and it will be sent to your registered email ID, which you used while you register for the webinar. Of course, each and every session will be having individual certificates. We are trying for it. We have coming sessions in line for the next 2 to 4 days. 2 to 4 sessions are in line. In July 3rd, a session is being handled by Dr. Smita Manoj, who is the medical superintendent of MVR Ayurveda Medical College, on the topic Panchakarma in Jwara Chikitsa. And again, on July 8th, we have Dr. Chitra G. Nair. She will be presenting a paper on Ayurveda pharmacy and law and practice, Ayurveda pharmacy, law and practice. And on July 10th, myself, Dr. Vineet, will be presenting a paper, and it will be on Padartha Vijnana and the empirical foundation of Ayurveda. It will be on July 10th. July 13th, we are planning to have Dr. Gopakumar, the renowned orator in Ayurveda. He will be discussing on the topic, and the schedule is just to be fixed, and that will be followed in all the social media, and will be reaching you. On July 13th, we have Dr. Gopakumar, and we have sessions to come. And so the session 2 is actually rolling up, and we have it coming in the coming days. It will be updated to you. So it was a very good session. We have even more doubts which was raised in the chat rooms. Of course, the link is there in the chat. Of course, you can join the WhatsApp platform, in which Dr. Muraleedharan will also be available. And he has already shared his WhatsApp number, so you can raise your comments and you can raise your doubts over there. Of course, he would on time be reciprocating back to you. We will be updating this video on Facebook. We had a certain technical issue, so that we couldn't forward it live, but we'll be coming with it in the evening. So it will be available in Facebook, and of course in other pages also. We'll be updating with you. So please join the WhatsApp channel, so that we'll regularly update you with all the updates. So that's it. I think Kunjaraman sir, we may conclude the session with thank you, and that's it from me, sir.
Okay, you can finish it with a vote of thanks.
Okay. I think that's it. So thank you for your participation. Thank you for your participation. We'll see on July 8th with Dr. Smita Manoj, who will be presenting on Panchakarma in Jwara Chikitsa. Hopefully, we will be meeting then. Thank you very much. Thank you very much. Oh, I mean, I have a correction. It will be on July 3rd. July 3rd. Dr. Smita Manoj will be presenting on July 3rd. Thank you.